then lower half, so in here. So from this one, that's why you will see the separate process here, but not near to the separate process, because if you are will be putting that on the separate process, of course you're gonna break the separate process. So on the sternum, half of it, so in here, okay? So position your hand here, your heel, and of course put the heel on your other hand. Put the heel on your other hand, your other heel. That's right. And of course, strengthen your arms and position your shoulder directly over your hands. So strengthen your arm, and of course, give compressions at a rate of 100 to 120. So barring one, go. Barring one, barring show.
Use your strength.
Two, your strength. Parang kalaki. So I'll show you, see how you're gonna do it. See in here, see? 1, 2, 3, 4, 5, 6, 7, 8, barring 29, 28, barring 30. So that's all how you're gonna do it. Okay?
Okay.
Okay, so at the end of each compression, so press down at least 5 centimeter. Remember the depth, okay? That's why the depth, okay? That's the 5 centimeter for the adult. And 1/3 approximately 5 centimeter for children, and 1/3 approximately 4 centimeter for infant. Okay, so remember that one. And at the end of each compression, make sure that there's the chest to record. That's why after compression, that's why bariman, as they going up, that's the month we call the chest record. Okay, in the house. And of course, minimize interaction to chest compression. So this is already done. So as you can see on, so this is that, and how you're gonna position it. You'll just wag kang malas dyan. Okay, so next. So delivering breath. So how you gonna deliver the breath, guys? So in delivering breath, remember there's 2 ways on how you're gonna open the airway. So the first one is the head tilt chin lift maneuver. So as you can see in here, so from that side in here, so head tilt chin. So this is the chin, and of course you're gonna do it this way. See here. Okay, head and then up. Okay, you got it? That's the head tilt chin lift maneuver. That's why you have the mask. So you have your mask in here. So that's in here. See, now I'm gonna use this one, and in here to cover, so that there's no air that's gonna come out. Of course, see, that's on how you're gonna do it. So that's why easy flap. This one we call it easy flap. Okay, so remember, so head tilt chin lift maneuver. So you gotta do it this one, and then provide breathing. After that one, another number 2 breathing. But for the rescue breathing only, what you're gonna do, provide only 1 breath in every 6 seconds for the adult. For the infant or the children, it's 1 breath every 2 to 3 seconds. Remember, if you're not breathing. So another jaw thrust maneuver. For the jaw thrust maneuver, used in the spinal cord injury patient. So this is the jaw. So as you can see here, you're gonna position. You need to open it. That's why you're not allowed to do this way, because the patient is of course already in spinal injury. So you're gonna open here the airway. That's on how you're gonna provide it. See? So jaw thrust maneuver. So you're gonna open that way. You're not allowed to do the patient like this way, because you are protecting it and then you are opening the airway. That's it. So as you can see in that illustration, that's the difference between the 2. Jaw thrust maneuver and then healthy chin lift maneuver. Okay, so you have your pocket barrier devices. This is the pocket mask. So if you don't have the pocket mask, this is also the it's like made of plastic that you can use, that you can cover already, just covering the mouth of the patient. Because before, even there's no pocket mask or there's no the one that's plastic, they can do already provide. But if you don't know the person, if the patient, if they have communicable disease, then it's gonna be transferred to you. That's why you have the pocket mask or the barrier devices. And of course, bag mask. So pocket mask is ideal for 1 rescuer. Bag mask used when there are 2 or more rescuer. And then you have the easy flap. That's on how you gonna do that one. So in here, so you need to provide it. So that's why 2 rescuer, you hold that one. See, this one. How I'm gonna do it? You'll use easy clap. So you have your C, E, and then this one C. You got it? That's why they call it easy class. Okay? So that's why you need to cover that one. Go. Okay. So make sure to have that one. That's why if you're gonna tilt it, so what I'm gonna do, that's why 2 rescuers. So 1 and then 2. The other one doing the compression in here. You understand? And then the other person rescuer preparing the AAD. That's on the multi rescuers. Okay? But if you are alone, you are 2 person, of course doing the done 1. And then make sure the chest is raised. Okay, if it's not, it means that there's the someone what do you call this one? The airway. Okay? Julius. Okay, so how to use the automated external defibrillator? So first, what's the use of the AED? It uses to eliminate abnormal heart rhythm. Okay, and of course, it restores the cardiac cycle of the heart. This is one of the questions in the test question. So they will ask what's the use or what's the purpose of the defibrillator. Of course, your answer there is to eliminate the abnormal heart rhythm or restore the cardiac cycle of the heart to become normal again. So what is the universal step? The universal first step. This is also included in the exam. They're gonna ask you what's the first universal step you need to turn on the AAD. Turn on the AAD. So after the cycle, so you need to finish the compression first. After that one, that's the time that you need to provide. See, turn on the AAD, then it will give you the prompts or instruction that you need to on. After one, apply the pads. So for the pads, guys, so we have for the baby and we have the baby pads, and we also have, because it's what I don't know. So we have the pads for the baby, and of course for the pads, there's already the position where you're gonna put it. There's the back. For the baby, it's only here, center, and of course in the back. Okay, that's for the baby pads. And for the adult, we have in here. So this is already the position. You remember where you're taking the auscultation? I mean the auscultate the apical heart in here, right? Mid-clavicular line with on your left arm, left mid-clavicular arm, and of course lower that one 4 to 5 to 6 in costal. And of course the other is on the right clavicle above of it. That's where you're gonna position the one. See? Apply the pads, make sure you remove the backing away from the pad. This is the backing, okay? That's why you need to remove that one. And of course, use the right size of pads, use child pads if 8 years old and below, follow the correct placement. For adult, upper right, just below the collarbone. That's why in here. This one upper right is below the collarbone, and then the other one is on the left mid-axillary just below the nipple line. Approximately 7 to 8 centimeters long. So this one, you're gonna put it in here, there's already in here, so you're gonna put it in here, and the other one is below the right clavicle. So that's on how you're gonna do it. So turn on the AED and then apply the pads. Let's try to apply. And this one, the backing. So you need to remove this one, huh? And after removing it, you need to apply it on the side. See, below the nipple line. So, and of course, the other one. So, you need to remove this one. If you're not gonna remove this, how you gonna split? Okay, and in here. Okay? After that one, so for the baby, for the children, I told you, anterior means front, posterior back. So only here. And of course the back. Remember guys, child pads may not deliver enough energy to restore the electrical activity of heart of an adult. But you can use it vice versa as long as the pads will not be overlap and follow the correct placement accordingly. So for the adult, you cannot use that, of course, for the infant. But for the adult, you can use it for the infant. So, special consideration in using the pads. Remember this one. So, if you are using the pads, heavy chest, it will not stick the pads. That's why there's in the medical kit and the AAD, there's that shaper. So you need to shape first that area before you can apply the pads. Another, immerse in the water. That's why you need to wipe first the water, especially from that one patient. In the swimming pool or one in the beach. of course, what's gonna happen? So there's no pulse, there's no breathing. Cardiac arrest already that one, so you need to bring the patient. This is one also question in your exam. So bring out the patient first out of the back of the water, and of course you need to remove the water, and of course that's the time to talk like that. And implanted pacemaker. What's that pacemaker? Those patients, especially that the pacemaker that's artificial heart. So you need to be careful that one, not directly to that area. So you need to move. And another transdermal patches. What is that transdermal patches? Your patches that you are using applying to your body. So you remove that first, that transdermal patches, and then of course you need to clean that first because there's the moisture. Okay? Those are the considerations that you need to remember. Okay, so are you in there? Ano gusto sila? That's why they are keep on chatting. Ano sabi nila dyan? Aminin na natin talaga ako na pero ako pa talaga mag-a-adjust sa mga to. Kaloka. Alam nila may klase, dapat sila mag-adjust. Ito kinakasarap ko eh. No, that's my problem. I will be the one to adjust to them. Of course, they know that they have their class. Of course, they should be prepared. Okay, so that's it. And of course, after that one, so first, you remember, turn on the AAD and apply the pads. So after that one, see, I applied already. So I turn on the AAD, wait for the prompts, and of course, apply the pads. After that one, the third is plug in the connector. This is what you're gonna connect to the AAD. Okay? So you need to connect that to the AAD then. What it says there, so just continue the compression. See, once you are applying, guys, the AAD is the another person. You are the one doing the CPR. So you are compressing the other person putting the pads already. It will not stop. You need to finish first the 5 cycle or 4 cycle. So it's in there. So there's the cycle for that one. You need to finish that one first to continue. Even there's the AAD, you need to finish that one. You need to wait for the sign. And once you already connected that one, it will say analyzing heart rhythm. You have to clear. When you say over, you need to clear, do not touch the patient. No one's touching the patient. So analyzing the heart rhythm, there's the, in AAD, there's the prompt in there, but there's the one to analyzing heart rhythm, just continue, and then there's the prompt clear. They will say like this one, that's why the person doing that one, you need to clear. It means no one's gonna touch the patient. And wait for the analysis, no shot advice, then you need to resume the CPR. So after that one, shot advice, the AAD will charge, then they still need to do the CPR because still the CPR will gonna charge again. So just continue the CPR, just wait, and then analyzing heart rhythm, then of course clear. It means that you need to do that one. And when you see flashing light on the shock button, loudly say clear because there's the for the another and you're gonna provide. So you need to press the AAD again. And resume CPR, it will reanalyze after 2 minutes. Wait for the advanced medical help to arrive. That's why it's in there. There's the ambulance. Of course, they will come already to transfer the patient to the hospital. And so this is the position of the pads. And another, so just this one, we're gonna discuss it to you. So remember guys, what's the first thing that you need to do? Verify the SIM safety. So you're gonna see that one. So you're gonna check, erase the SIM. After that one, so make sure the environment is safe for rescuers and victim. If not, it's not safe, then you need to transfer the patient, bring it to another place. That's why you have your carries and drugs. And of course, recognizing cardiac arrest. So what you gotta do? So, hey, are you okay? Are you okay? hey, are you okay, are you okay? After that one, you need to at least 10 seconds, within 10 seconds, you need to check there's no pulse, no breathing. Okay? After that one, if there's no pulse and no breathing, then activate emergency response. And bring AAD. It means call 999 and bring AAD. Automated external defibrillator, AAD. That's one how you're gonna say it. And of course, remember, that's why emergency response. Check for responses, no breathing or only gasping, no normal breathing, no definite pulse felt within 10 seconds. That's why within 10 seconds, make sure you know that. Breathing and pulse check should be performed simultaneously in less than 10 seconds. That's why your position in here, not like this way. In here. Okay? You are listening, at the same time, you are palpating the carotid. So next, if no device, no mobile device is available, phone emergency services. So if you know that one, so call someone, do that one, activate emergency response. And if you are alone, remember this one, adult for adult. If you are alone, so remember this one for adult and adolescent, if you are alone with no mobile, leave the victim to activate the emergency response and get the AAD before you beginning CPR. Guys, if you found out that the patient has no pulse and no breathing, after that one, you are alone, you just leave the victim and you call someone, you need to activate the emergency response by yourself. After that one, if you call, then you need to return to that victim. Not you are continuous check already, then you are continuous CPR without the, you need to activate first the emergency response. Okay? So otherwise, send someone and begin CPR immediately, use the AAD as soon as it's possible. But if you are with someone, you are not alone, then you can ask someone to rescue this. So, witness collapse. This is for the children and infant. Follow steps adults and adolescents on the left. It's the same thing, witness. But if it's unwitness collapse, if you didn't see that one, give 2 minutes of CPR. Unwitness. But if you witness, if just the same this way, unwitness, if you are not in there, so what you're gonna do, give 2 minutes of CPR. After that one, leave the victim to activate the emergency response system and get the AAD. Okay, so 2 minutes, you need to perform the CPR. After that one, you need to leave the victim and return to the child or infant condition the CPR. Use the AAD as soon as it's alright. So first, for the adult, it is an adult and adolescents. If it's in there, you are alone, you need to activate the emergency response, then return to the victim. But for the adolescent, for the children and infant, unwitness, okay? Unwitness, this means that you need to give first the CPR for 2 minutes. After that one, leave the victim and then activate the emergency response. Then you return to the victim, you need to provide that CPR. But make sure that you need to check first the responsive of the patient. Huh? After that one, guys, remember the compression ventilation for 1 or 2 rescuer. For the child or adolescent. 1 or 2 rescuer, you need to have someone, that's why you have partner in here. Julius, come here. Sleepy. So what you gotta do, you check already, you found out there's no pulse, no breathing. So I am here, right to rescuer. But after that one, see what you gotta do. So I will tell to Julius because I found out because we are to rescuer, no pulse, no breathing. So Julius, activate emergency response, call 999 and bring AAD to me. So he will go. After that one, I'll just continue the compression. So Baring 1, baring 2, baring 3, baring 4, baring 29, baring 30. That's how you're gonna do it and provide. So I am alone. So you just gonna do that one. So 1, then 2. Okay, after that one, just continue baring 1, baring 2, baring 3, baring 4, baring 29, baring 30. After that one, just continue. After 4 cycles, I need to finish. Julius just arrived. So AAD, so turn, you will say to that one, turn AAD, and then he will be the one applying the pads. Okay, so you are applying already the pads. You turn on the AAD first, that's the first step. Turn on the AAD and apply the pads. After you have applied the pads, then he will be the one to connect the plug, the connector to the AAD, but just continue. Just wait for the prompts, just continue CPR. So after that one, analyzing heart rhythm, the AAD is talking already. So what you're gonna do, then you need to clear, so you need to over. After that one, there's already for the AAD. So just continue. So analyzing shot, it's already the no shot even. You just continue the CPR. So given for the 2 minutes, the AAD will gonna talk on time. And then click the flashing lights on the AAD. There's the flashing lights on there. Okay, so just take it.
Flashing light.
And this one. For the children or infant, one rescue word is the same. 30:2. Means 30 compression and 2 breathing. That's the ratio. That's why 30:2, the 30 you're talking about the compression and the 2 is the breathing. For the 2 more rescue word, for the infant guys, I'll just take the baby.
Are you okay? Not the baby. Are you okay?
Hey, are you okay? Are you okay?
Hey, are you okay?
Hey, baby.
So for the baby guys, it's different. One rescue word, 30:2. But if 2 rescue word, it's only 15:2. So you have that one, so the rescue word, so you have the bag, so you just gonna hold this one, Julius.
Keep it down.
Put it down there. Okay, so you provide this one and position. So you gonna have that one, hold this one. AC plan, Julius. Oh my gosh. That's why I don't know how you're gonna do this one. Easy plan. So how are you gonna do it? For the baby, there's different also. It depends how you're gonna do like this one. You can use your 2 fingers. Okay, so just gonna press it in here. So in here, 1, 2, 3. So bearing 1, bearing 2, bearing 3, bearing 14, bearing 15. Then provide the breathing. Head teacher, you gonna press that one. After that one, you gonna return. Head till chin lift maneuver. Remember? So you gonna do this way. Okay, Julius? Once you are in that. Okay, so that's on how you're gonna do it. So 15:2 by 2 rescue word. If you are alone, only 30:2. Next. Continuous compression at the rate of 100 to 120 minutes. So give one breath every 6 seconds. So 6 seconds. So 1, 2, 3, 4, 5, 6. Then another 10 breath per minute. So that's on how you're gonna do that one. And for the children and adults, in fact, it's the same. See, remember your rescue breathing? 1 breath every 6 seconds for the adult. And then for the infant or children, it's 1 breath every 2 to 3 seconds. Okay, so remember that one. So compression rate, it's the same 100 to 120. That is your compression. And of course, compression depth, so remember that one, at least 5 centimeter. And then for the children, at least 1/3 the AP diameter. And of course, the chest compression, and of course, approximately 5 centimeter. For the infant, approximately 4 centimeter. So for the hand placement, you know that already. So for the one breastbone, it's the same for the children. Children also in the breastbone. And for the infant, guys, 2 finger or 2 thumbs. How are you gonna do that one? 2 thumb encircling. So 2 finger, or you have this way, 2 thumb. So and how are you gonna do it? Support the back. How are you gonna do it? Support the back of the baby, and here is your 2 thumbs. So it's either 2 finger, you're gonna do it like this way, or support it this way. The other is in there. So 1, 2, 3, 4, 5, 6. You are supporting the back. Okay, so 1, 2, 3, 4, 5, 6. Baring 1, baring 2, baring 4, baring 3, baring 30, finish. That's on hand. Then you're gonna provide the rescue. Okay, so 2 or more rescue word. 2 thumbs, so 2 fingers or 2 thumbs is in the center of the chest, just below the nipple line. So you can do it by 1. It's 1 rescue word, you can do the 2 finger or the 2 thumb. But if you are 2 rescuers already, you can do the 2 thumb encircling. 2 thumb encircling, we call that one 2 thumb encircling. Okay, so if the rescuer is unable, for the infant is unable to achieve the recommended depth, it may be reasonable to use the heel of the patient. I mean your heel, if you cannot achieve the depth of compression. So, chest recoil, allow complete the chest work after each compression, do not knee on the chest after each compression. That's why I did not lean for that one. So that's why to fill in the gaps. And of course, minimize interactions, limit interaction in chest compression to less than 10 seconds. So compression, when you say CCM is that the chest compression action. And for the AP, you remember the AP, the anterior posterior, back, and of course the front. The AP diameter. That's why anterior posterior, the front, and then the back when you are doing the chest compression. So that's it. The abbreviation 6 centimeter. Not more than 6 centimeter for the chest compression. Not allowed. That's why 5 centimeter. So this is how you're gonna locate the pause. So for the infant, you remember for the infant in the brachial. And this one for the adult already. So it's, for the infant, it's in the brachial, and of course for the child, you can assess also in the carotid or in the femur. And there's the chest technique compression, finger technique compression, chest compression sa younger. So you have already this one, see the 2-finger technique, and the other one is the thumb inserting. That's why and how you can do it. Next. So relief of foreign body. Relief of body, area obstruction, if ever there's the obstruction, see, if the patient is choking, see, here, ask, are you choking? If the victim nods yes and cannot talk, severe area obstruction is present, take steps immediately to relieve the obstruction. Give abdominal thrust of victim who is standing or sitting, or chest thrust for pregnant or obese women. So Julius and then is Mr. Sammy, come here. If the patient is choking, so how you gonna do it? So you are here, so Julius is standing here, so you are here at his back. Okay, so how you gonna do that one? You have this one, right? This is the image maneuver, and here in this area, okay, in the diaphragm part, so in the lower. So you gotta do it. That's why you're gonna do it this way, right? Masakit, I'm sorry. So I'm not gonna do it, but you're gonna do this area, and then of course that's why you are pushing, choking. And if the patient is unresponsive because it's not still, because you continue doing that one, if the patient becomes unresponsive, that's the time that you need to check that you need to perform the CPR. Okay, do it position here. Oh, you have our bouncer here, huh?
No, I should. No, yours should not go like that.
Like this one, like this way.
Yeah.
Yeah. Because you are pushing it this way, see? If that's patient,
This thumb should be here. So
Your
you
thumb?
push it.
yeah.
And this.
See how I'm doing it? Sammy, how you gonna do it? That's one is in here. So that's why it's pushing it here and here. In this area, the below your side will pass. That's why it's going to so that the push it, gonna vomit that. So it's already out, the patient become unresponsive, there's no pulse, there's no breathing, that's when you're gonna start the CPR. Sitting or standing. Okay? Give abdominal thrust of victims that one. Activate the emergency response by opportunity. Activate that one. After about 2 minutes of CPR, if you are low, you don't provide still the same. Lower the victim to the floor and begin CPR. That's the same way. So for the children, are you choking the same abdominal
Lamig
thrust?
talaga, uy.
And for the infant, guys, in the infant it's different. It's different, no. We have that one. So if the victim cannot make any sound or breath, severely airway obstruction or present, give to 5 back slap or 5 chest thrust. For the baby, you need to hold it this way. That's why supporting like this one. And you need to lead it like this one. Then 1, 2, 3, 4, 5. Or of course in here, we're gonna provide another on the back. Until sometime you're gonna check that's blocking the airway of the victim. So this here, I know I have that one. So we have this one, the choking. Severe airway. That's normal. So as you can see in here, stand. That's on how you. See this one, how you're gonna do it. Or if you are alone, you can do it by yourself. Stand or kneel behind the victim. And see, for the pregnant, see how you're gonna stand. And the other one, doing this way. That's why you're gonna hold yourself like this. And the other one for the baby, I have for the baby. For the baby, it's that way. That's why you can give 5 dots lang. 1, 2, 3, 4, 5. That's why you are holding that one. 1, 2, 3, 4, 5. And in here, so 1, 2, 3, 4, 5. That's why. That's why it's here. See? Here, down. That's yeah, you need to slide. Of course, that's why it will go. Not like this way. You're gonna do it like this way. How come it will not? Come on.
Hindi namin alam eh.
That's why you know now.
Now we know.
Okay, so that's for that one. So we're gonna perform the we'll just search, maybe they have the CPR on the online.
Yes,
Yeah, so we can see it. So this one you're gonna have it so that you have to have your what do you call this one?
No,
Your BLS.
Na, kuha na dahil. Nakita ko din sa live dahil. Nakita ko din sa live.
Ako ko pwede support ko. Support na dahil. BLS. Sexy.
Kain mo.
Life support. So today's topic will be about basic life support, where I will be giving a step-by-step guide and enough time for them to rest. The UK ambulance number one, that is, you get your enough person that goes into cardiac doing it if you're on your own and starts step-by-step guideline on what to do with.
Okay, so you listen to this one. So about the BLS. After that one, you're gonna have a video. Sa akin ang gusto.
When you encounter someone who needs acute medical assistance. So we start by saying what exactly is basic life support. More commonly, it's known as CPR, and it's actions performed on someone whose heart has stopped, aimed to buy enough time for them until emergency services arrive. It can be performed by medical personnel and anyone who has qualified in first aid. So how important is BLS? Well, several studies have been conducted and shows that BLS is extremely important in increasing survival rates of people who have undergone cardiac arrest. The UK ambulance services receive several thousand calls from suspected cardiac arrest. However, they are only able to perform resuscitation in about half of them, as patients have expired due to not receiving bystander CPR. It's that important. So what do you do when you see someone who could be having a heart attack? Well, first of all, you have to ensure it's safe to approach the victim and ensure bystander safety, no wires, any hazards, liquids, etc. Now, you start by assessing how the patient is. You shake them, you ask them if they're okay. If they do not respond, you do a sternum rub. That is, you get your knuckle and you rub the middle of their chest to evoke a response. If there is no further response, then we know that something serious may be going on and we start to look at the airway. However, if they do respond and the patient is breathing, but they look a bit drowsy, stay at the side and observe any changes that may happen until the paramedics arrive. So, we know that the patient is not responding to our cues. So what we do, we place them on their back. And we open the airway using a head tilt or toe thrust maneuver as shown in these diagrams. After opening the airway, we assess if the patient is breathing. We have to do this extremely quickly. This is a critical situation. So you look for any chest wall movement, you listen for any breath sounds, and feel for any breath coming from the nostrils or mouth. A point here is that when a person goes into cardiac arrest, the heart has completely stopped. And it's important not to mistake the normal breathing someone gets with the agonal respiration seen in cardiac arrest. So this is a survival mechanism kicked in by the brain. it's a brainstem reflex and occurs when there's a
See how you're
decrease
gonna assess the breathing at the chest wall,
call for help
rising
is
or not, and of course,
extremely
you
important.
need to
Shout
listen.
out
That's
to
why you're
the
gonna
people
listen. That's why you need to listen, and at the same time, you're observing the
as
chest.
possible. How to conduct CPR? Well, we begin by assessing the position.
That's what how you're gonna place your heel of your palm.
About 2 fingers above from the xyphal process or the tip of the sternum.
This one, if you're gonna put in here, it's gonna break the cycle
You
process.
also interlock your other hand and make sure that pressure is not applied to the ribs. You don't want to crack any ribs.
Then relax your hands.
It's important to make sure the hands are not further down, as it may cause the patient to vomit and aspirate and
Make sure you press it. The compression is the compression that is 5 centimeters per adult.
So, we have to start the compressions now because the patient is not breathing and not responding. Now, it's important to make sure when you are doing compressions, make sure your shoulders are
You are
directly
pushing
on the
with
side
your
where
body,
you
not
push.
your arms.
Press. You're pushing with your body, not your arms. If you push with your arms, you will
It
get
must be 5 only, not that much 6
and that will
centimeters.
not help anyway.
5 only,
So we
5.
press down with a depth of 5 to 6 centimeters. No one really assesses how hard, no one really measures the depth of which you're pressing, but you get an idea that this has to be quite a lot of pressure applied to the chest wall. So this is done at a rate of about 100 to 120 per minute. Rescue breaths. Now, you should only give rescue breaths if you know how to. If you do not, then just continue giving CPR. So after 30 compressions, you give 2 rescue breaths. You tilt the head of the person back, opening the airway, pinch the nose, form a seal with your mouth, take a breath in and blow into your mouth, watching for chest movement. And each breath takes
But they're
1
not
second.
teaching already,
Do not
because sometimes
interrupt
you're under.
compressions for
That's why they are
10
teaching that
seconds.
so that if you're gonna provide this one, but we have already the back one. That's why you remember you need to put that one, and of course you need to do. Because we're not doing the actual. Because if not, because you don't know the patient, the victim. I told you maybe without that. This is, you don't know. That's why you need to be clear.
Electrodes to the patients as while the other one is still
Or
performing.
there's also the plastic. It's like you're gonna remove it from you, plastic, and then it's transparent plastic. There's the hole is that's how you're gonna apply it to the patient,
It's quite weird.
the victim. There's the whole like the
Recovery position. If a patient, however, does regain
recovery
consciousness,
position.
it's good. You have to place the patient in a recovery position. Now, this recovery position.
So this is already the recovery position, huh?
You raise one of the arms as if they're waving to say hi. Secondly, you place the other hand on the opposite side of their
Like
face.
this, the other one like this one over
With
here.
that, you bend the knee.
Yeah, bend the knee, the leg.
Towards yourself.
Yeah, that's already the recovery.
Recovery position.
It's
And
like
do make
not
sure that
moving
you have it tilted back so
what do you call this one? Moving the patient to the other
this is
first
the
side.
recovery position.
Yeah.
We have the references, all the information that I have
So we're
gathered.
just gonna have a video. Let's search it online on how you're gonna do it. First aid training, step by step, how to perform the CPR.
I'm here to show you what to do if you see someone suddenly collapse and they don't seem to be responsive. First step, we're going to ensure that there is no danger. Then we're going to check for response from the person. We're going to ask them a few questions and we might actually even pinch their shoulders to see if they'll respond. Hello, can you hear me? What's your name? Squeeze my hands. This person is not responsive. So the next step is to send for help. The number in Australia to call emergency services is 000. At this stage, I would also encourage, as soon as bystander support arrives, for them to locate the nearest defibrillator and get that over to us as soon as possible. Next, we're going to check the person's airway. We're going to tilt their head back, open up their airway, and check if there's anything obstructing. No obstructions, we're going to check if this person is breathing. So we're going to look over the person's chest, and what we're looking for is that normal, gentle rise that our chest does when we're breathing. We're going to listen for any sign of normal breathing, and we can also feel that chest for any sign of breathing. The person is not responsive,
Within 10
or they are
seconds.
not
Within
breathing,
10
or
seconds.
they're not breathing normally. So we need to start CPR. To locate where we're going to place our hands on the person's chest, we can go to their underarms with our pointer fingers coming to the centre of their chest, and then with the heel of our palm, we're going to place the hand down, keeping our arm straight, interlocking our other arm, leaning over the person's chest, and we are going to push.
See how she's pushing it. Your body is the one pushing it, not your arm.
Now we're actually going to push hard and fast. We're going to push about a third of that person's depth of their chest, and we're going to also allow for that chest to rise back to its normal position. Now we're pushing at a beat of about 100 to 120 compressions a minute. If we're willing and able, we can do rescue breaths. So to do a rescue breath, we're actually going to tilt the person's head back, pinch their nose, open up the airway, and I would put my mouth over the
If
person's
you don't have
mouth,
anybody,
forming a seal, and I would offer 1 breath, 2 breaths,
yeah, 6
and then I
seconds.
would come back to my chest
Just
compressions. Now I'm getting a bit tired, so I'm going to get that bystander support. And I'm going to communicate really clearly for a smooth handover for minimal time off the chest.
At least 10 seconds.
1, 2, 3,
I told you within 10 seconds you're gonna transfer.
and I'll take over again.
1. So at least 10 seconds, make sure that there's no.
So I've just demonstrated how to do CPR. Our next video will demonstrate how to use a defibrillator.
Okay, so how
Don't
you gonna use the
forget,
defibrillator?
CPR can save a life. In this video, I'm going to demonstrate how to use a defibrillator. By this stage, you would have started CPR already. Once the defib arrives, you're going to turn it on and you're going to follow the prompts. The defib will give you really easy and clear instructions of what to do.
Remove all clothing from patient's chest. Hold right handle to reveal pads.
Now it's time to place the pads onto the person's bare chest.
Apply pads to bare skin exactly as shown in the pictures. Press
But this one with the other is
At
fewer,
this
but for
point,
you continue the CPR, huh? You are still continue doing the CPR, and the other is fewer, regardless of that one already.
and it will
Okay, with the
advise
other is fewer.
a shot.
There's
is
the
being
scissor.
used. Step back from the patient.
Okay, there's
and
the
keep your
scissor.
hands in the air.
If you need to cut the
That
clothes
way,
of
when
the
the bystander
patient,
knows,
you can use the scissor in that one.
Delivering shock.
See? Hover, shock
Shock
delivery.
delivered.
If a shock was not successful, we need to
Then you
continue
continue
with
the
CPR.
CPR.
Provide chest compressions to the feet. The heel of one hand should be in the center of chest. The other hand should be on top of first hand. Push down hard at least 5 centimeters. Stop chest compressions.
After 2 minutes of CPR, the defib will actually stop and analyse that
So we
specific
have 2 minutes.
If the shock was not successful, we'll need to continue with our CPR. If the shock is successful, you'll notice.
I will check where's the context. So I will ask already the questions. Is that what's
Me.
So I'm gonna ask you the question for you. No, I'm not gonna send it. I'm gonna send it once you are ready. So the first question is, because it's 2 types, type A and type B, but just the same, they just rumble the questions. So the first question in there, do not tell to them that you know the answer, huh? I mean, you know the question. No. So when performing a high quality CPR on adult, What action